Adrian, you're next.
My name is Adrian Hoyt, and I'm the Tri-County epidemiologist.
Awesome. Melissa, welcome. And you're our guest today, so we've got to all behave ourselves, don't we?
Wait, and I'm the Tri-County epidemiologist.
Do we have two Melissas? Just me. There we go. I'm Melissa Brewster. I am the director of pharmacy at Mosaic Medical. I believe I'm new to the committee. I'm not quite sure. Replacement for Steve Strang, who left recently, also from Mosaic. So,
Thanks, Melissa. Aaron?
Hello, I'm Erin Fitzpatrick. I'm the Director of Quality Improvement with Lapine Community Health Center.
Thanks. Laura?
Hi, everyone. I'm Laura Hart, Management Analyst at Deschutes County.
Thanks. Heather?
Good morning.
Our long lost connection, who's back.
Yes, sorry I missed you all last month. I was dropping off a kid to study abroad, but Heather Keisner, Deschutes County Public Health Director. I still get to say I'm new for the first year.
I don't get any of it.
And I have a fun mug that says public health is my jam that I got from last week from a retreat.
Wow. Colleen?
Hi, I'm Colleen Sinsky, the vice chair as of a couple months ago, and I serve as the executive director of Central Oregon Fuse.
Lindsay?
Hi, Lindsay Atagi with Pacific Source. I am Community Quality Coordinator.
Thanks. Logan?
Hi, Logan Clausen. I'm the Chief Medical Officer at Central Oregon Pediatric Associates, and I apologize, I'm home with a sick kid, so if I intermittently go off video, I will be right back.
That's allowed. Sarah?
Hi, my name is Sarah Barron. I'm at Central Oregon Community College. I teach public health and also new program director for the Community Health Certificate of Completion. Excited about that one.
Thank you. Matthew?
Hi, everybody. Matthew Christensen, epidemiologist here in Deschutes County.
Thanks. Charity?
Hello, Charity Ludwig, Senior Director of Clinical Operations for Dentistry.1. And I have my grandson today, so I will be off camera.
Emily?
Did I find my mute? I can't see myself. So Emily Horton, Program Manager for COVID Recovery and Emergency Preparedness.
Thanks. I think I got everyone. Did I miss anyone? Please.
Actually, just me, Tom Kuhn, Public Health Program Manager at Deschutes County Health Services.
Excellent. Thanks a lot. Moving on to September minutes. I actually read them, but if someone could tell me if there's any amendments or anything, and then move to approve them, that would be great.
Any edits or a motion to approve with a second?
Move to approve.
I'll second that.
Thanks. Any modifications or anything? Otherwise, we're done with that one. We're trying to move along today because we've got numerous presentations. So I'll invite anyone to give an announcement and update. I'll just use my prerogative and say that the the Accreditation Council for Graduate Medical Education. So our psychiatry residency, the first step is to get it approved by the national body so that we can continue on pending funding discussions. We have a site visit in October, and that means will likely be approved as a residency site by the spring. And the progress on that is really dependent on CMS funding, but that's my announcement. We've got the steps moving along. Other folks?
That is exciting. I met with Julie Downing yesterday, or more like a couple weeks ago, actually. And today we're meeting with the CTE directors, career technology education directors. Now community health is one of those. And we were talking about the Madras expansion, about what's happening with your residency program. And today I'm meeting with the RN, the MAs, the CNAs to talk about how we can incorporate public health workforce pathway more within those.
Oh, cool.
With the Madras expansion. Does that make sense? Do you see the connections?
Yeah.
So the idea is that we start incorporating public health with the Madras campus expansion. That's exciting. So as you do your work, it actually informs our work too. So that's cool. And this advisory group helps too. So anyway, that's the new announcement. We're an actual pathway is that now the CTE world, the community health work, public health has an actual workforce pathway. That means we get more funding, we get to be incorporated into the workforce, we get recognized. We can have a coffee about that later if anyone wants to talk about what that means, but it means more money and being recognized. That's what I can say right now. I don't want to take more time for that.
That's cool. What Sarah's referring to is that there are two residency programs potentially coming up. One is coming for sure in Madras. We're interviewing residents starting in a week or two, and they're going to be on the ground in Madras working at Mosaic, Warm Springs, and the hospital starting August of 2025. And they'll be in Portland in July of 2024 to start their residency, which is really exciting because it's the first program of graduate medical education here in Central Oregon, which has been needed for the last 25 years, and we're finally moving along.
And where I was going with that is that as that workforce develops here, we're trying to get something for community health at the same time to really kind of take the work that you've done and jump on the tail of your wings, as you say, is when that energy starts to push open a door. I love to get in behind it. So
perfect.
If that makes sense.
Other folks, any announcements about their or information about their progress or lack thereof in their various institutions, organizations, and trying to make Central Oregon as good as we can get it?
So I can share a few things. So you're all familiar with public health modernization. So talking about local funds and workforce, we submitted for the next biennium to OHA for our regional funds that support Adrian's position, our infection preventionists work, and our climate and health work. And we're awarded the Tri-County funds. Didn't get everything we wanted, but we were aiming high, so got what we needed. A little bit of negotiation there. So exciting to be able to continue that work in this next biennium. And then now working so that's one pot of funding we get from public health modernization from our legislators. And then the other pot is local public health modernization, which also funds quite a bit of our Deschutes County public health positions got a little bit of increase there. So really working on how we maintain our kind of core preparedness team as we continue to lose our COVID funding. So I feel like I'm in a game of Tetris right now, but excited that we're able to continue a lot of the work and the positions and the people. So more to come on that. And then I don't know if you all heard the OHA director, Rachel Banks resigned. She's going back to Multnomah County. So there's a little bit of a leadership hole at OHA right now between the overall OHA director and the public health director. So not sure how that affects all of you, affects us greatly. So just wanted to make sure you're all aware.
Well, and some context for that is actually the Oregon Health Authority, which calls itself an authority, decided to essentially defund the public health expansion by giving away money to non-public health agencies, which I think was a huge mistake. Who ultimately made that decision?
Oh, Dr. Ross.
No one takes responsibility, right?
So we're working through it. We had a coalition of local health official retreat 2 weeks ago.
Oh, good.
With OHA, had lots of discussion, a lot of healing was done, and how to move forward. And I think some good things are moving forward as far as, yes, there's funding that now also goes to CBOs, which, you know, it's important to fund CBOs, and how do we work together to make sure we're all kind of going in the same direction when it comes to public health priorities, which I think we do well in Central Oregon. But local public health will be much more heavily involved this time around in the application process, which we were not last time. So
Oh,
yes,
great.
so they heard us loud and clear at the retreat.
Excellent. Other folks, any other news?
Well, I just had my two standing announcement items that are on the agenda. One is that we are tentatively shooting for October 18th for myself and Rob and Colleen as the chairs of PHAB to go before the county commissioners with our edits that we made to our PHAB bylaws. As I had mentioned, I believe at last meeting that was our plan of action. It's been reviewed by county legal. And so I'll be submitting that paperwork here this week. We have plenty of time since it's in 2 weeks, but that's what we're going to shoot for, is the 18th. And the other item I just want to bring up is that our next PHAB scheduled meeting, which would be November 7th, will be the PHAB retreat, annual retreat that we've been trying to do in the fall every year. And more details to come on that. Myself and the chairs will also be meeting offline in the next week or so to do some planning around that. So just want to make sure everyone's aware, and that will be an in-person lunch provided meeting, and hopefully we can come up with some good items for planning for the next year. So just so everyone is aware of that.
Awesome. Thank you. So can we move on to the regional health assessment update if no one has other announcements, and we can fit in everyone's presentations? That would be great.
Yeah, and we have with us two health services staff members in public health, Laura Hart, who's the management analyst, and Adrian Hoyt, who's one of our epidemiologists, and they're the ones that are going to be giving this update. So take it away.
Awesome. Adrian, are you cool if I provide an overview and then you can do your deeper dive into data? Awesome. Thank you so much.
That would be great. And Tom, are you going to be able to let me share my screen? Okay, cool. Sounds good.
Awesome. And I will do the same. So let me get going on that. Okay, and you guys see all this okay?
Yes.
Thank you, Adrian. And let's do from the beginning. So I just have a few slides here, recognizing we do have a packed agenda. So we'll just move right along, but thanks so much for the opportunity to speak here today. Very excited to present to you all the tremendous work that has taken place over the last several months to inform the regional health assessment. And the slides that I'll be showing, I really want to give a shout out to COHC. They have done a tremendous job kind of documenting and organizing and putting things in a way that's really visual and digestible, that I'm just able to share the same information with you to kind of stay consistent on what we're showing and messaging and so forth. So shout out to them. So this first slide, Adrian's going to be taking a deeper dive into the data analysis process, and we'll cover this slide as well. But I just wanted to provide a brief reminder of all of the different components that are really being utilized to develop this ROS. So it is the regional health assessment is this package of really rich information about our community. The secondary data information is information that already exists in the databases, and the community health survey is a data collection method for the RAW that ended just a couple days ago, September 30th. And so the analysis is now currently underway. And I spoke with our COHC team members yesterday, and it sounds like we've received a little over 3,800.
Hey, Laura, sorry to pause you. It looks like somebody's asking if the slides could be a bit bigger. They're kind of hard to read.
Let's see.
Can you put it into presentation mode? Maybe that'll make it better.
All right, let me do some. Okay, I'm just going to stop my share really quick and end this. Okay, I'm just going to leave it like this. Thanks, Adrian. Appreciate that. I cannot see the chat. All right, let's try it again.
Sorry to disrupt the flow.
No, I'm so glad that you did. Is this any better?
So I would just go to slideshow and then start the slideshow. Because you're in the right place right now. Just go over to the far left and hit begin.
From the beginning again?
Yeah, and then it should show the whole screen at that point. And then
Okay.
you can just skip through to the next one.
Is that any better? Because it's the same for my view.
Huh. It still has the next slide coming up, but it does seem a bit bigger. Does that seem okay for folks? Okay.
Sorry.
I think the response is that that's fine. So that the next slide showing is a little smaller, so the screen's a little bigger.
Yeah, sorry about that. I have no idea. Okay. Well, and I'll try and read some of the stuff out loud just in case we can't see. So I was mentioning the community health survey, and just that there were about 3,800 responses that came through for our analysis period. So we had relaunched the survey in March and really pushed out this information. We had English and Spanish toolkits, lots of different organizations present and trying to share this information and get feedback from our community. So glad to hear that we did get some responses there. And again, the data analysis is underway, and that'll be really interesting to see what some of the common themes are. Lastly, on this slide, there are some listening sessions and focus groups. And this is just another way to collect primary data while also providing the opportunity to dive deeper into some of these different topics than what was previously available within the survey. So I'll go ahead and go on again. I'm sorry, I wish I knew how to minimize any of that. So I'm really excited to show you, we had approximately 20 focus groups that were identified earlier on in this process as groups of folks that we really wanted to engage and provide an opportunity to elevate these voices. And you can see that there are a variety of groups and different community partners that help participate via focus group or walk along interviews or photo voice. And so I'll go ahead and just mention a few of these in case you guys are still having some trouble seeing. Black Man's Group and the Fathers Group has been completed. Various councils like the Community Advisory Council, Provider Engagement Panel, Peer Support Specialists here at the county, Latino families, college students, veterans, seniors, community health workers, North Klamath, men working in construction, high school students. And so all of these items have been completed. And going through, these were done in a different way. Again, either panel discussions, walk along interviews using photo voice. And so it was completed with LGBTQIA through the Ellipse Theater community, folks who are unhoused, rural migrant farm workers, caregivers, folks living with disabilities, and then some more opportunities for high school students. I believe this slide was from September, and so those last two items that were in progress have been completed. So very excited to see all those now that the analysis is underway, what some of those common themes are. So now I just wanted to take a couple of minutes to discuss some of the upcoming events and opportunities for involvement if you or your different organizations have any interest. And please keep in mind that still some of the planning pieces for these events are still in development. So the last phase of our data gathering activities is to provide 6 opportunities or open houses for our region, for folks around our region to participate and to be able to see the preliminary data that we've obtained from these community health surveys, the listening sessions, the secondary data analysis. And so providing these opportunities really empowers our communities, community members to gain a better understanding of all these different things that are, impacting our community. And this really provides some visibility to things that they will perhaps identify as either a strength or weakness. And so it also gives them an opportunity to have a say in the decisions that will ultimately, impact their lives, their neighborhoods and regions. And so these are called community gathering, data gathering or gathering events. World Cafe was a name that had been used previously just as a way of describing what will in fact happen here. So you can see on the left side under event that there are a couple scheduled for Deschutes County, and this is all within kind of the first 9 days of November that these items will take place. One Northern Klamath, Crook County, looks like a third one in Deschutes, and then Jefferson County. And just to give you a little idea of how these will look, the attendees will be able to rotate data stations where, again, they'll be looking at this preliminary data and answering some guided questions. And so they also will have an opportunity to talk about and participate with some of these conversations with other folks there as well. It doesn't necessarily have to be an individual thing. So, and then attendees will have the opportunity, again, to talk about the strengths and challenges related to both community health and social determinants of health. So of course, housing, working conditions, education, but also number of providers, accessibility to services, transportation, and so forth. And so these consensus workshops are ultimately, again, this last piece of our data to really help highlight and bring forth on what we're going to shed some light on for our 2024 regional health assessment. And then I mentioned that there would be some opportunities to get involved. Again, some of this is still in the planning phases, but for Deschutes County, there's 3 here, Crook, Jefferson, and Klamath. COHC have identified that they would really appreciate some additional help with setup and takedown, welcoming or orientation. They're going to hire some interpreters, walk along guides. Essentially, it's not our job to, influence anyone, but if they have questions on how to read the slides, for instance, if we say, okay, you know, this slide has to do with our rates of syphilis in Central Oregon. This axis is you know, year to date or different years. And then this one is the number of cases, and you can see that it's moving in this direction. It's just kind of keeping the basic information of how you read the slides so they can make their own interpretation. So again, if you or your organizations have any desire to help with any of these in the first week of November, certainly feel free to reach out to myself, Tom. Carmen is on this panel. And I'll make sure too that these slides can go out to you all afterwards, just so you can kind of digest this a little bit more, since I am moving pretty quickly. Lastly, I just wanted to take a really brief moment to share with you what the outline of this regional health assessment will look like. And I am really thrilled that we're able to provide a space to not only highlight what is happening in Central Oregon, but to further break it down by county, so that we're showing what's happening in Crook, Deschutes, and Jefferson's, because the story may be very different than if we just put those things together as Central Oregon as a whole. And then I also, just for some awareness, have advocated for some sort of a public health spotlight to ensure that the strengths and challenges and some of the red flags that we're seeing, you know, and as public health folks in Crook, Deschutes, and Jefferson are also included in this raw, so that even if these things are perhaps not selected as a top 3 strength or top 3 challenges through those data gathering events, that there's still a place for them to be shared, to have an awareness just from a public health perspective. And I do just want to point out, yes, we're focusing on the top 3 of all of these things. And we know very well that there are many, many, many more indicators that we're interested in throughout the counties. But part of what we are doing this time around is really focusing heavily on our Central Oregon Health Data site, and over 400 indicators can also be found there as well, to really, really help paint the picture of what is happening in our community. So that was a lot of talking. I'm going to stop sharing my screen. Really happy to answer any questions. Otherwise, I know Adrienne will be taking a deep dive into data. Thanks so much for your time.
Any questions from anyone?
Okay, Adrienne, are you ready to go?
Sure. Okay, so I'm going to share my screen. That's doing that thing again where it shows the next slide. I wonder how to fix that if it's like some setting.
If you go back to the PowerPoint thing, maybe it says online presentation. I don't know.
I do. If you want, you just go back to the Microsoft and you just do single slide presentation under presenter view. I can walk you through that, or you could just do it like this, whatever's best for you. But you have to get out of it to do that. This is from my Zoom pandemic teaching online days. I actually
think
know how
right
to
there,
do it.
hide presenter view should work. Oh,
Hide presenter view. Did she you could do that one too.
Oh, okay. What? Let's see.
It's under PowerPoint slide presentation, and you just do single slide view. Do you see hide?
the 3 dots at the bottom. Click that. And then I think there was one that said hide presenter view.
Oh, good. Or you could go up to a custom slide, present online. You could do that one too.
Or is that online?
See what that does. Nope, forget that, cancel. Yeah. All right, well,
Sorry, guys, I didn't realize it was gonna do this, so, how does that look right now?
perfect.
Okay. So I think I'm gonna go with what's showing now. If you guys have any issues with seeing anything, we can readjust along the way. Okay, I want to say thank you to Laura for giving a great overview. And I want to apologize because I see quite a few of you that were just at the Raw Steering Committee meeting, and some of these slides might look a little familiar. So sorry to revisit some of this again, but I think the brainstorming session that I have at the end will be new. Hello, everyone. My name is Adrienne Hoyt. I'm currently the Tri-County epidemiologist working out of Deschutes County, and I'm going to provide you a brief overview of our RAW Regional Health Assessment Secondary Data Analysis Update. So here I want to acknowledge a few of the data sources that I've relied upon for this effort. There are more, but these were kind of the key players. So you can see these on the screen. And a roadmap for our discussion today, just revisiting the required content for the RAW. Laura already went through quite a bit of this, but I just want to refresh everyone's memories, is kind of think about what is secondary sources for data versus primary sources, and then looking at where we are, like a snapshot in time with our secondary data analysis right now. And then a short brainstorming session at the end. I would love to hear some ideas from this group on just thinking about secondary data presentation at our upcoming community feedback events. So here's this slide again. I'm not going to go into great detail, but just to remind folks that secondary data is really different than our primary data because this is data that's already been collected by another source, whether it's OHA, CDC, our regional health site. It's data that's already available versus our primary data. As Laura discussed, our community health survey and our listening sessions are really the prime sources for that. And you can kind of see there for required content that we're gathering different things based on where our sources are being drawn from. And ultimately, we're coming over here to take all of these sources together and collate our 2024 RAW. This is just a broad overview slide of, I kind of bucketed these into steps for our secondary data collation and analysis. Step one, which we've just finalized, was searching for our data and collating the data. And I have a pretty massive spreadsheet where we've been putting these indicators together and finding sources for them and that kind of thing. We have approximately 150 indicators, so we have a lot of data that's going into this. The second step is really diving in now into our preliminary data analyses, putting together some presentations, getting some feedback from some of our stakeholders. And then ultimately in early November, I think we're slated for the first week of November to present our data, not just secondary data, but what we've collected from our primary sources at our community feedback events across our Tri-County region. And then step three is really where we take everything and we finalize our data analyses. This is where we start putting together our narratives, any late breaking feedback, and bringing everything together into assimilating our overall RAW, which is slated to be released in February of 2024. And feel free, if folks have questions along the way, I want to make this kind of discussion style. So feel free to interrupt me or raise your hand. Okay, so there is a lot of data in the world and a lot of data that we have in our Central Oregon region. So we had to kind of think about where we would prioritize some of the sources where we'd be pulling data. So early on with our core raw group, we got together and decided that we have this great tool, the Central Oregon Health Data Site, and then that would be our priority for looking for some of our indicators. And so that's where I went to first as I was moving along with the secondary data collation. If I did not find the data on the Central Oregon Health Data Site, I would explore other sources. And you can see some of those listed on the bottom right. As part of this process too, it's been very important to not only kind of catalog where the data is located, whether it is a Central Oregon Health Data Site or CDC or some dashboard at OHA, or we're pulling it from Orpheus, and then really putting on there the years of available data, because sometimes the data needs to be updated. And that's where a special data request comes in, or maybe we have to search for another site. Maybe the data is no longer being collated from that particular source, and then thinking about timelines for when the data will be available if there's waiting periods. Okay, so right now we're moving into step 2, and this is where I've been doing a descriptive analyses across our indicators in our Central Oregon counties. Separately aggregated, and also looking at comparisons with the state of Oregon when we have that data available. And then the next step is really starting to prep the data for public release, and taking in consideration such as small numbers and that sort of thing, and what we're going to put out there publicly, creating data and graphics. And then you can see down on the bottom right, we start to have I call this the digestion period, where we're starting to look at trends, disparities, similarities, and differences across our counties and our region, and then thinking about this in the context of prepping for our community feedback events. So this was my rough attempt at kind of taking some data and bucketing it into, this is a comparison of aggregated Central Oregon health data across each of our counties, and seeing kind of where we're doing better with some of our indicators. And this is just a handful. We have many more. So I just wanted to kind of show you guys that, you know, there's many ways to present all of this data as we're starting to think about how we're doing well and maybe not so well. And you could kind of see, I've put together kind of a barometer for that, but just the caveat is each of these barometers may look a little bit different based on, like county stratifications. So from this group, I would love to get some input on brainstorming ideas for presenting what we just have loads and loads of this data. And I show here in these balloons, so to speak, in the circle here, that these are broad domains that I've bucketed across our region. And each of these, we're looking at 10 or so different indicators, depending on the domain. And I've put together some preliminary PowerPoints for each of the domains, kind of looking at high-level nuggets or highlighting some things that really stood out to me as I was looking through some of the disparities and differences across the counties. And some of this is really in the weeds with some of the graphics and the tables that are presented, and maybe showing to our public health colleagues that's an okay strategy, but in the broader context of a community event where folks are going to be visiting different tables and digesting some of this data very quickly. Not a lot of time, and maybe not so much analytical background and graphic interpretation and that kind of thing. I'd love some thoughts on just best methods for getting information across very, very quickly and succinctly, if you guys can understand my ask.
This might be a far out thing, but I teach a lot of adults public health, and I use games And I won't go into the games I use, but I gamify it. So that they start interacting with it. And also it kind of slows people down to ask questions and not feel overwhelmed with it.
Yeah, that's a cool idea. Maybe we can talk offline about some of your
Yeah.
ideas for that.
Yeah, I have ones I use with my community health worker class and peer support specialist class. And they keep saying they want more of it. So they don't seem to like PowerPoints that much. They kind of shut down when I do too many PowerPoints. They used to be much more tolerable of it, but now I think they want something where they can kind of interact with it and ask questions, but then feel like they're getting some moments where they're like, and that might be coming from my health promotion days too, because we used to gamify things when we did outreach events too. So anyway, we could talk
cool
offline.
idea.
We could put some of my COCC students to work on some of those ideas too, if
Awesome.
that's something they love to do.
Thank you, Sarah.
Sure.
I think when you're talking to the lay public, also, I used to be really involved with our community health or regional health assessments and improvement plans. And when you're talking to the public, really thinking about context and story, because there's a story that you can tie to this data set that helps people to sort of absorb what you're saying and remember it, because they're not going to go home to their partners or family and retell them, oh, well, we're seeing, a 60% increase in syphilis in our communities. But they may say, hey, did you know that we're on this highway system and that truckers are carrying syphilis more frequently, and that's why we're seeing this increase in our community, or something like that. That's just an example that I'm making up. But so I think the importance of story can't be like overestimated. And then the other thing I would say is just that Tableau is so beautiful at creating data sets that you can look at and interpret really well, and I think are helpful for understanding large pieces of data and complex data in really big ways. So just using good graphs.
Awesome. Thank you, Melissa. That's helpful.
This is a lot of topics. Is there a way to?
Yeah, and this is only half of the domains. So we have some contractors that are taking the other half. It's a lot.
Right. So is there a way to, figure out which are the most important ones?
Well, I think part of what we're doing at these community feedback events is to get a better understanding for what our community thinks are the important ones.
Yeah.
Well, I don't want to take up all the time, but if you guys have some ideas about that, feel free to email me. Maybe I could put that in the chat, or I guess we all have our emails from the send out for this meeting, right?
Yeah, should.
Okay. Well, I appreciate everyone. And I just had a final acknowledgement slide. So just thank you to all of my colleagues at COHC and across our counties, and folks that I've reached out to at OHA and other organizations that have helped with this data effort. And that is all I got.
Thanks for your presentations, you guys, Laura and Adrian. That's awesome.
Of course, thanks for listening, and thanks for the feedback.
Okay, I think Emily is up next.
I think you're right, and I'm going to pull up a few slides, although I don't have as much info and data, and some people on this call can probably correct some of the information. Sorry, I'm having a hard time with my internet connection today, even though I'm in the office, which is always frustrating. So I am going to do a quick COVID update. Can you all see my screen loud and clear?
Yes.
Okay. I went ahead and converted to a PDF so that maybe it was easier to see in larger scale. Okay, so I'm going to do a quick fall update. And the overview I'm going to use is I'm going to go over some surveillance data. Then I'm going to talk a little bit about access for vaccine, therapeutics, and testing. And that is pretty much what I have. So the first thing I wanted to mention is Adrian probably can talk a little more about this, but in the next couple of weeks, we're going to have a respiratory virus report that's coming out of public health that includes RSV, flu, and COVID. So if you guys all remember last year, Adrian did like weekly reports during flu season for flu and RSV. This year, we're planning on a little bit more comprehensive report that will be all three of those together, and kind of pulling those out and posting on our website. And there'll be a weekly update that goes out.
Just to correct, Emily, sorry to jump in.
Yeah.
So we decided, yes, we're going to release the info on these, but they will be 3 separate reports, but they're all going to go out at the same time.
Okay.
Yeah.
So 3 reports all together at the same time, but it will have all that information in there. And then I'm going to talk a little bit about wastewater, and there's kind of 2 pieces of that. One is BioBot and one is OSU, a little bit about hospitalizations, and then access to vaccine, therapeutics, and testing. So for wastewater, we're really lucky here. We have a lot of buy-in from our local Bend community, and the utilities department is totally on board with using wastewater any way they can. Heather can speak to this a little bit, how exciting Jeff, who's in charge of that, is about doing all of this. So through the whole pandemic and back to when Dr. Conway was here, you know, there was a lot around wastewater. They collect weekly from the influent in Bend and Sun River. Just, I know probably most of you know this, but I'm just gonna say it anyway in case it's a reminder. That wastewater data goes to interpretation at OHA, and you've probably all seen kind of the tableau that OHA has. It goes then to CDC and also BioBot. So if you look at any of these sources, it's the same collection point and the same analysis through OSU that data comes from. So when we look at these, it's all normalized in a little bit different way, but I think looking at the OSU and the BioBot are kind of 2 easy ones. And then for some reason, CDC and OHA are a few weeks behind. So it makes it a little less helpful when you look at their data. So the first one you can see, this dotted line is the national average of wastewater. And then the darker blue line is Sun River and Bend average for Deschutes County. So you can see kind of those ups and downs. And then basically we had kind of a surge in August, and then we've gone down at the beginning of September and then kind of back up in September. If we look at this, and anybody stop me if you have questions, I may or may not be able to answer them. So OSU puts out a slightly different type of analysis. So they have 2 graphs that they come out with. The first one, the top on the left-hand side, the top graph you can see is all the data points for the whole time they've been measuring. So that started in September of 2020 through now. And then they kind of bring in, and this is normalized basically for the effluent and the population. So the other one wasn't normalized by the population, but this one is. And they have this green, yellow, kind of orange and red sort of scale that kind of normalizes it over the course of the pandemic. The second one below that is just the past year. So it's a little bit tighter scale. And you can see that we have kind of bounced between the yellow and the orange over the last several weeks. So that's, I'll tell you exactly. Yellow is considered moderate, which is moderate compared to all the levels measured throughout the pandemic. And again, that's the log of the virus RNA per person per day in the watershed. The second graph on the left, the little star is the latest sample. So you can see for Bend versus the all-time values, this latest sample is in this upper quadrant here. And so that kind of helps a different visualization of the same data. So if we look at Sun River, there's a lot more variability, and you can think about several reasons why that might be. One is the population that comes in and out of Sun River is highly transient, lots of vacationers, and that probably changes when they're normalizing the data for the population. If you think about the size of the population in Sun River is highly variable, but they're not going to know that exactly every time. So there's a lot more variability there. But again, we're mostly in that moderate or strong range for the values in the last several weeks. And this one was a little in this lower than average. So as far as hospitalizations, I focused on the Region 7 hospitalizations. So you guys are probably all kind of familiar what Region 7 is, but I just put a little map of the counties and the hospitals that are included in this. So you could see exactly what that is. And then this is the last 6 months, the number of COVID-19 patients hospitalized. So this is inpatient hospitalizations. And we can see this is going up over, from middle of August, basically until now. And I think the last data point was about 20 some patients were hospitalized in Region 7. Any questions? Okay. So now the great vaccine access question. I think probably everyone on this call is aware that right now it's not great. I think we were all aware that this probably would happen with this change to commercialization. It's a little bit messy always when the system changes midstream, and there's always hiccups. So I want to focus on 3 kind of categories here: what we're doing at public health, what the pharmacies are reporting, and then what the providers are reporting. So our vaccine comes primarily through OHA and the Bridge Access Program, which is funded through CDC. So we put in an order of COVID doses for adults, kind of to mirror what we typically ask for flu pool vaccine, which is to serve those underserved populations. We have started to receive some of that vaccine in and are planning on using it for those targeted populations at community kitchens, shelters, other places where people don't have insurance and wouldn't be able to get it. We also are trying to get billable vaccines to use and go in to help long-term care facilities where there's not a lot of access, and they're like smaller facilities where they can't contract with a pharmacy or do it themselves. So we're trying to fill in some of those gaps in those targeted settings. We are not planning on doing large scale clinics like we have in the past. So just to put this in kind of perspective, I think last year from September through December, our clinics, we had about 80 clinics and we gave almost 12,000 vaccines. This year, we just don't have the access to do that because there's not free vaccines. So we're really trying to reset what's normal and send people to pharmacies, which is the next kind of set of information here. Pharmacies probably aren't happy about that because they also have inconsistent access. When we talk to pharmacies, and I don't know if Melissa, you have any, info here, but they're getting really inconsistent deliveries. They don't know what they're going to get, when they're going to get, based on the orders they have. It just is kind of haphazard. So most of them are doing more like walk-in clinics instead of allowing people to schedule and then having to call everybody back and cancel those scheduled appointments. they're more like, okay, we got 100 doses in today, we'll just give them to whoever's here and happens to be waiting. And then planning on doing more of those scheduled doses once they have consistency in what they're receiving. And then the last one, oh, I missed a slide here. Shoot. I don't know what happened to my other slide, was just about community partners. Let me see if I can stop my share and then find that slide. Best laid plans. Slide is completely missing. Okay, well, I must have accidentally deleted it somehow. Let me see if I can just find the information. Essentially, we did some access. We asked all of our community partners, so St. Charles, and maybe someone on here could tell us. I think they're going to have about 2,500 doses that they're planning on giving at all of their clinics. COPA, I think, is on, so they could probably talk to exactly what they're doing. Mosaic, I know you guys are planning on having regular doses at your clinics. And I'm not sure. Summit is planning on doses, but smaller amounts. So I think, again, most of our community partners are planning on having doses, but they just don't have much yet and are kind of waiting to see when they can get it. So.
Yeah, and Emily, I'll just add a couple things to that if you don't mind.
Of course, yes, please do.
So Mosaic has moved to Moderna only because of all of the issues that we saw with labeling with Pfizer and some of the mix-ups around, diluent, et cetera. And so we would love to be able to refer families and kiddos to the health department who still would like to receive Pfizer. I don't know if that's a possibility or not, but wanted to ask that question.
Yeah, so Heather, I don't know if you want to chime in here, but yeah, go for it.
That's a big maybe, unfortunately. So I'm just going to be I've been in the immunization world for a long time. And with the commercialization, it's a lot more challenging. And I realize the expectations of our community from the last 3 years has been public health will provide all of these clinics. And we're really moving back to what we do with flu vaccine, that we truly are that safety net.
Yeah.
And we're waiting to find out, this is really nuanced. There's so many different buckets of funding in the US when it comes to vaccinations. Don't get me started on it, but we're waiting to find out from Oregon Health Authority if we can vaccinate insured people and and then they bill us for it. So because we don't have money to front the cost, pretty much. I can't go out and buy a ton of vaccine.
Right.
So we're kind of waiting on that. So I think for children, we do have some vaccines for children with Pfizer, but for adults, it's a lot trickier.
It does sound like the billable for adults is coming from the state. So I'm expecting that. I'm keeping an eye on it too. But yeah, and I totally support you guys going more to safety net, and I understand why completely. And I think maybe as a community, if we decide, we are going to, not rely on public health to say, if you want Pfizer, you need to, go over here. That's fine. And I think we can just tell patients, because the CDC allows you to interchange, even though it's not totally recommended. So we can tell patients that, they can look for their own options if they choose, instead of like sending them to you. So I appreciate that. I also just wanted to mention that, the sort of release of Abrysvo and Arexvy, so the 2 new RSV vaccines for adults, and Beyfortus, the new RSV vaccine for or monoclonal antibody for infants, is really, I think, all of this happening at the same time with flu and COVID. It's really a heavy lift for organizations. And so I'm sure a lot of you are feeling that. And so it's really nice to have like respiratory data that is, coming out, to have that reporting to rely on, and so that we can share that with patients so that they can understand the risks. And so I really appreciate that a lot. Yeah.
Thank you. And I would just add, if there's any areas or venues that we could provide the data that you think would be helpful to, especially our healthcare providers and partners. Because Adrian was really putting together, and Emily, some really rich data that we are sending out weekly. But yes, anything that we can provide that would be helpful to all of you. And I completely feel your pain that all of us doing at once.
I know that the PHAB directors, so I know Logan, you're on this call, and then Ellie, and then Michelle get together regularly to meet to talk about what's happening with RSV and with vaccines in the PHAB area. And so I'm sometimes getting information that kind of trickles down from that meeting. And I don't know I think it may just be like an informal thing where they're meeting up together. But I think that the pediatric directors really would be really important to sort of target for that type of information for sure.
So the only other thing I was going to mention was just quickly on test kits and therapeutics. So I wanted to make sure people were aware the Color Health program for OHA that they've had for quite some time, which is like a telehealth program and therapeutic. You can either send the prescription to a pharmacy, or they have a mail kind of prescription through that, is still operating. So I know that there have been some questions and like some issues with people accessing therapeutics. So that program through OHA, if you just Google Color Health OHA, is a really easy program for people to access to get therapeutics still for COVID. And then as far as testing, the USPS has the mail-in test kits that people can get still, and we have lots and lots of test kits. So we have lots of places where people can pick them up. If you go to our websites on, Sisters, Lapine, Redmond's, and Ben's, anybody can go in and pick up test kits for free. So, if it's helpful, those are some resources that people can get pointed to as far as free testing and therapeutic access if they get diagnosed. So that's kind of all I had for the COVID update. I don't know if there's any other questions.
I would just say, I think it's evolving. I think what we say this week could change next week around vaccine access. So, I think the biggest thing right now is this is happening nationwide, some of these delays and the frustration around kind of the transition from the government kind of paying and providing all the vaccine to going to the commercial market. So we're just hoping for patience. I keep thinking it's going to roll out, it's going to get better. But let's keep talking, especially Melissa and also the PEDS departments, if there is continued access issues and where we could potentially try to step in.
Awesome, you guys. Thanks for the update. What's the latest variant?
Oh, you tell me.
B25 or something? I can't keep track anymore.
I know. 365 days later, right? No, I'm just joking.
I know at OHA we wanted to end on pie. So we'll see.
Adrian, I see your hand is up. Is that for this?
Yeah, I think that was a great update, Emily. I just wanted to add, I appreciate you sharing those contacts. What was it, yesterday for wastewater at OSU collation, and Emily provided some contacts from OSU, and I've reached out to them to see how they could maybe provide some information that we could add to our reports right now we just have a link to OHA dashboards for wastewater, but we might be able to include some more detailed stuff. So I'm going to get with them and see how we can incorporate that, what they collect too, because it sounds like not just COVID, but possibly some flu viral information and maybe RSV too. So it would be great if we could track all of that, you know, together with, you know, these public reports that are going out.
Yeah, all three, according to them, will be monitored starting October 1st. So I think that will help with that kind of comprehensive respiratory viral picture, independent of testing and some of those other, you know, indicators that we use to be a proxy for what's really happening. I don't know if we would say, or even they would say it's a leading indicator, because a lot of times, you know, the data does take a week or two to come, but it definitely helps keep a pulse on what's going on independent of that. So.
Right. And any encouragement to give the elderly RSV? This is a completely new thing, right? That will be much appreciated. Because we've seen a lot of those cases last year, well, a few over the summer, but certainly this past 12 months, a lot of RSV admissions amongst the elderly.
And I think the mortality rate for older adults is close to what it is for influenza.
Right.
And I don't think that's well known. And so I think like spreading some of that data, like what, you know, around what's the mortality risk of RSV would be really good. And then I think the ACIP recommendations for those vaccines, I think there was a little bit more sort of issues around like Guillain-Barré and some more side effects than that they've seen with other vaccines. And so they decided to make it not a firm recommendation to get, but more like, you know, a patient and a clinician need to talk with each other and make the decision, shared decision making essentially. Mm-hmm. And so I think having some of that data around RSV risks and mortality for the elderly that we could share would be helpful.
Yeah, I mean, I think the second part of that's difficult is right now with the insurance and all the pieces of the RSV falling in place, at least we've heard some frustration around access. So it's the same with COVID, right? Like either it's a recommendation or a shared decision-making with your clinician, but even if they say, go ahead and get it, and you want to get it, some people are having difficulty.
So I think it's Part D on Medicare. So most of these folks will be Medicare, and so it should be covered with zero copay at pharmacies. And so we're figuring out, you know, how we get that covered. It won't be covered in a clinic, so they probably need to go to a pharmacy to receive that vaccine.
Okay. Well, thanks a lot, you guys. And in the effort to keep us somewhat on time, Colleen, are you all ready?
Sure, I can be. And I was also just going to offer that if it would make more sense for me to delay until next time. I know a lot of folks had to take off, so I could go either way. I think last time the presentation was a bit abbreviated because of time. So Rob or Tom, do you have a preference? We can kind of speed through again or wait until there's more time.
Yeah, I mean, I guess we wouldn't want you to have to speed through it. We do have about 15 minutes available, but if you prefer, we could just end the meeting early today and then have you give a more lengthy presentation at a later time.
Whatever works, Colleen. We don't want to shortchange your talk again.
I'm happy to go either way. I don't have a strong preference. I know that two of the folks who asked me for more information aren't here right now.
Yeah, Commissioner Chang was one also that
agree.
Yeah, I saw him in the other day and he apologized for not being able to come. So why don't we have you give like the amount of time you need, and hopefully the commissioner will be here. And
yeah, I guess one thing I can mention is thanks to Melissa from Mosaic for joining us today. And Melissa has applied as a Public Health Advisory Board member representing Mosaic. And so this is the first meeting she was able to attend, and looking forward to having you on board. And we will be reaching out to you very soon to do interviews with you, with myself and our chairs, and then we'll circle back with the group before requesting that you are appointed. So thanks for coming.
yeah, thanks for sure.
Okay. Well, I guess we're going to just wrap up early and give everybody a little bit of time today, if there's nothing else, unless somebody else has something for the good of the order they want to add.
Can I ask one question since I have Dr. Ross here?
Sure.
Yes.
Um,
Don't show me a rash.
no. Is there any, there are some hospitals around the state that are what I'm hearing are considering kind of mask policies this respiratory season. And I'm just wondering if St. Charles has talked about that. I mean, I'm just curious because we've heard rumors.
Yes.
And yeah, so I'm just
We are, and I'm not sure what the ultimate outcome is going to be, but I suspect we might be masking here again come end of October or November. But yes, it's definitely on the docket.
Okay. Yeah, so just keep us posted and let us know, so we make sure we're messaging, and supporting
Okay.
you all. I don't see any indication of anything outside of organizations deciding to do that on their own at this point, but
Yeah,
keep us posted.
maybe we should all be masked all year everywhere, like in China and Japan, and we wouldn't even have RSV or any of this. Of course, we'd never recognize anyone, but
Can I make one announcement? Sorry, I should have said this in the announcement portion, but it actually just came through my email during this meeting. That we're going to be having a groundbreaking celebration for Cleveland Commons building, and that's Central Oregon's first purpose-built permanent supportive housing. Would love to invite you all. You do need to RSVP to it through Housing Works, but that's going to be on Monday, October 16th at 2 p.m. And that's it. It's Cleveland and 4th, 1024 Southeast 4th. You can reach out to me for more info, but if anybody would like to join a groundbreaking, you'll see me with a shovel spray painted gold or something.
do we all get golden shovels?
If you're nice, and if I can find some really cheap shovels.
All right, thank you, everyone. And thanks for the donation of your time and effort. And we'll see you all at our retreat.